welcome to our monthly practice call. Our agenda will be a report on our PDSAs, data review with Ed Wise, clinical questions with Dr. Jensen, a few LS3 pre-work instructions, and reminders and announcements. As usual, please mute yourself if you're not speaking, and do not put your phone on hold, and feel free to ask questions and make comments anytime. Slides will be emailed to you after the webinar, and a recording will be made available on our website. Okay, well, let's start off with a quick review of our PDSAs for the month. And Amber, thank you for calling in. I know you're on here. I hope you can see this okay. And if you want to just go over and sort of explain your PDSA for this month, that would be great.
Okay, can you hear me okay?
I can.
Okay. We are, you know, I'm kind of the leader for the project. It's just me. But I think I've convinced Dr. Stanford to come on board using the MeHealth, and then our on-site psychologist, Jay Morgan. They're both very interested, and we got them set up a week or two ago to just kind of start going through the orientation process with MeHealth. And Dr. Stanford seems very interested. He sees a lot of ADHD patients and diagnoses those on a regular basis. What we're most interested in, though, I think, is just the mental health tools that we can also access during MeHealth or through MeHealth, specifically the scared forms. So I think we're going to start utilizing those more because we're just trying to incorporate a mental health team within our clinic to provide services, not only ADHD, which we've been doing, but also some other comorbidities with the ADHD and the mental health aspect. So right now our goals are to kind of get them acclimated to MeHealth and start entering patients for us.
Mm-hmm. And I love that you're attending the REACH Institute courses. That's great.
Yes, Dr. Stanford has already attended, and then I'm on a waiting list along with 2 other physicians within the practice.
Wonderful. Going to look forward to it.
All right.
Yes, thank you.
This is Jen Powell. Kristen, if I could just make a comment there, that is just really exciting in so many ways. I love the way that you all are beginning to think about all of your, kind of your chronic conditions around mental health and how you can provide specific resources. But that's, it's a great way of really being able to sustain the work and address the needs of many kids. Do you all have a population registry as well?
We don't at this time. That is something that I thought we were going to do through this project.
Good.
Kind of like we did.
Yeah.
Okay.
We'll
okay. So that I just wanted to make sure I haven't missed anything on that end.
Great. Thanks, Kristen. I'm going way over. Sorry. Keep going. Congratulations. Great work.
Okay. Thank you.
Thank you, Amber. And let's see. Next up, we have River City. And Roger, I know this is so hard to see. I kind of hope you have a copy of it in front of you so that you can talk about your PDSA worksheet.
Yeah, I do have a copy. Just to kind of update, our PDSA so far have been just focused on just engaging the parents and getting them involved in the process, obviously, and also making sure they activate their accounts and so we can get the assessments done. And we've actually had some good success with the last one. Previously, after PDSA 1, we had about a 47% activation, and then after this last one, we were up to 65%. So much improved. We kind of want to do better, and we're looking at for this next round is kind of gearing up for school to start back, because we know right now not a lot happening, especially from teacher assessments in the summer and things like that. But we really want to make sure the parents and everybody we're enrolling this summer and up to date are activated so that when school starts back, we can really gear up on getting those assessments in. So that's the next round of PDSA for us.
That's wonderful, because I'm sure it's very difficult in the summer to just make sure everything's getting through to everyone when the kids are not in class. I'm glad that you guys are thinking about everything for the summer. That's great. And let's see, our next one is Sparks, and it looks like Dr. Nadvi just joined us. Perfect timing. Would you like to go over your PDSA worksheet? I'm not sure if she's called in quite yet. I can see her on the screen, but she doesn't have a little phone next to her. And Roger was saying that some people, it was more difficult to sign in today, that it was making you switch from Internet Explorer to Firefox. So I'm not sure everyone has been able to get on here today. I can go up one and see if Gail or Dr. Schluterman are here from Pediatric Partners. I don't see them on the on our participants list yet. Okay, and I don't think, oh, wait, maybe they are. Hi, is that either Dr. Schluterman or Gail who just joined us? No, okay, well, I will come back to Dr. Nadvi's. I can see that she's logged on, but I don't think she can make phone contact with us just yet. She might have just.
If you'd be willing to go ahead and when you have a minute, it's to send the link back out to all the participants, because I've not been able to get in under the link I've got.
Okay. Sure, I can do that, and maybe I'll try to do that while.
Kristen, this is Dr. Nadvi. I don't know if you can hear me. I just logged in.
Great. I have your PDSA worksheet up on the screen right now, and I'm going to let you talk about that while I get on my phone and try to. I just resent the whole login about 15 minutes before our webinar started, but I think some people are having problems. So I'm going to send it one more time, and Dr. Nadvi, if you'd like to go over this PDSA while I'm doing it, that would be great.
Yeah, this is last month's PDSA. Did you not get the one that we sent for this month?
Sorry.
Hello,
yes,
Kristen?
this is the one that Ashley sent me this PDSA for this month.
Yeah, this was last month. We had another one that we sent last week for this month.
Sorry, I believe this is the one that she just sent me for this month.
Oh, okay. But, yeah, we already went over this one last month.
Okay. All right. Well, let me just.
Without the worksheet, could you give us a brief overview of what you've been doing?
Basically, it was about the report card on MeHealth and trying to get a better understanding of the report cards on MeHealth and what functions we're supposed to be following and try to improve our numbers. But unfortunately, because of staffing issues and people being on vacation, we weren't able to actually have as much of a session with the whole team to sit down and go over each and every value of the that are being looked at on the report card. So we plan to do that over the next week or so.
Okay. All right. Excellent. Are there?
Okay. I just sent out that. Yes. Sorry. I sent that out again really quick, and let's see. So has anyone joined us from Pediatric Partners? Okay, I'm not sure who call-in user 8 is, but we can come back and see if maybe they join us in a little bit. Or Arkansas Pediatric Clinic, Anne-Marie? Okay, all right, well, we will move along to review of data with Ed Wise. And Ed, if you want to just tell me when to go to the next slide, that would be great.
Will do. Thanks, Kristen. Yeah, if you want to go ahead and go to the next slide, we'll go ahead and get started. So first, of course, we always want to look at the national data just to give us some context. So a couple of things I'll point out here that are relevant to the way we interpret the data for Arkansas is that measures 1 through 3, really I think the variation we do see there is just regular variation, and we're not really seeing any changes there. So what it means is that we're probably having challenges across every chapter regarding these measures, not just in your chapter. Also, I'll point out that the challenges are different for each measure. For measure 1, you might know that sometimes there's issues getting parents to log into MeHealth and complete the evaluation or the Vanderbilt. We're also having problems getting teachers signed up, and that's common across all of our chapters. The issues around measure 2 are involved with documenting the process. There's been some confusion on which fields to complete in order to document the needed fields for this measure, and again, that's been consistent across chapters, as you can tell by the pretty consistent and not really any improvement in that measure nationally. And with 3, it's really a challenge with the access to behavior therapy in all of our chapters, or at least in some parts of each state. We have seen some progress in measures 4 and 5, though, since December and January. And so you can see that measure 4 is trending upward, and we're up above the goal, actually, and have been for a lot of the project. Measure 5, this will be more valuable as we move along, and we have had more patients in MeHealth for more than 180 days. But of those that were entered as previous ADHD patients, you can see that a higher percentage of those patients are receiving a regular follow-up with Vanderbilt within 180 days. As we move along, that trend line is progressing upward. In the total symptom score, these have been pretty consistent from month to month. The total symptom score reduction for parent has been about 13% on average, and per teacher assessment, the average reduction in total symptom score has been about 11% nationally. Next slide. And one thing we should point out is that as we move along in the summer and as more of the patients are entered into MeHealth, of course, there are going to be fewer patients entered into MeHealth as we move along. So as you can see, in Arkansas, we were down to 23 patients entered in May, down from 52 in April. And if you look at the other practices, it's a similar trend now that, again, most of the patients have been entered, and we're probably seeing fewer ADHD patients as we move into the summer. Next slide. And again, this is just similar to what we saw the trends on the previous slide, but this is just on the practice level for the Arkansas practices. Again, we expect to see that little bit of a slowdown in the number of patients being added to MeHealth. Next slide. Now I wanted to break it down. This is Arkansas for measure 1. And again, you can see that there hasn't been any improvement. There's been a little bit of a drop-off since February, but since March, it's relatively unchanged, from 55% to 50%. I imagine that's pretty regular variation. So, you know, we're going to work on creating measures that maybe we can see change that we're not seeing with this measure. So, for example, maybe you're getting the Vanderbilts back from the parents and teachers, but you're not getting them back within that 30-day window that is part of this measure. Or maybe you're getting back the assessments from the parent, but not from the teacher. So moving forward, we're going to create some other measures so we can see if there's improvement that's just not being picked up by this specific measure. Next slide. And if we look at the practice level for measure 1, and these are the Arkansas practices, we can see that Sparks has done pretty well. Pediatric Partners has been consistent in starting the assessments. It looks like maybe the assessments are not getting back within 30 days, or maybe parent and or teacher are not returning their assessments, but the assessments are being initiated pretty regularly in Pediatric Partners. Next slide. And again, this measure, we think that there's a problem with the documentation. Maybe it's not being documented that the patient has been diagnosed with ADHD, or maybe it's not being documented that the patient has received the initial conversation and the booklet at the time of diagnosis. So what we're going to do is we're going to make this measure a little different moving forward too, and we're going to take the documented conversation we're going to take that part out of the measure. Moving forward, we're just going to report on the percentage of patients that have documented that they were provided the ADHD booklet from AAP. And that change should take place for the next month's reports. Okay? I didn't want to dig any deeper into that one since obviously it's an issue of data collection with that one. Behavior therapy, in the past we were looking at this as just current state, what percentage of the patients in MeHealth have behavior therapy prescribed to them. Now we're going to be able to look at it as a trend line. And so we can see that the trend has not changed too much from 14% in February to 17% in May. So that's pretty consistent as far as the percentage of patients that are receiving behavior therapy. And again, this is a challenge in all states as practices have trouble finding behavior therapy resources. If we go to the next slide, Kristen, we'll see that in Sparks, it looks like they've done a good job of finding behavior therapy resources and have had patients follow up on those perhaps. In Arkansas, the Pediatric Clinic and Pediatric Partners, and in River City, it looks like maybe there are challenges in finding behavior therapy for the patients. Either that or there's a question about documentation. And if there's any question about documentation from these practices, please let me know and I can make sure that you know which fields are needed to document behavior therapy being recommended to the patients. I also wanted to know if there was time or if we wanted to ask Sparks what is the resource that they have for behavior therapy.
Ed, it's very limited. We work with the providers that we have in this area, plus some in Northwest Arkansas. It all depends on insurance. With Medicaid, we do get more feedback and actually are able to get more patients plugged in. Unfortunately, with private insurance, a lot of it depends on what their insurance will or will not cover. And oftentimes we don't get good follow-up because of the high deductibles or whatever. Parents just kind of, you know, let that slide. But we do try to keep pushing them to make sure that they do have those follow-ups done. Certain insurances are harder than others. And so we've just been trying to call around and get as many resources and find out who takes what insurance so we can get those patients plugged in. And just 1 second.
I have a question, Ed. This is Dr. Ibrahim. What is everybody's take on doing some behavioral therapy at school? Because like Dr. Nadvi mentioned, we have a lot of challenges so parents doesn't want to take off work or insurance. So if therapy would be provided at the school, I think that would make a big difference.
Exactly, yeah.
Is that currently accessible there?
I'm sorry, I didn't hear what you said.
Is there school therapy, behavioral therapy? Is that what you're saying?
No, we don't. But I'm asking if there's other areas in the state that does provide that. Does the school system, the public school system in Arkansas, is there resources to provide behavioral therapy for these kiddos?
This is Kristen. I haven't seen it. I've taught in California, but I haven't heard of schools providing it here, but I haven't been involved in any IEPs. Maybe Dr. Jensen, have you heard of schools providing behavioral therapy?
It depends if they have a school-based health service. So, for example, there are several providers. The university, for example, has a bunch of schools in North Little Rock where they do provide therapy there. Now, frankly, it's not always behavior therapy. Sometimes it's just counseling. But if that's the only resource, that's usually something I turn to. There's also similar systems through multiple schools in the Little Rock area, and probably up in Northwest as well. But when you get into more rural areas, it's probably not going to be easy to find. what someone can do under, say for a Medicaid client, is refer to the local community mental health center, and some of those people will be trained in behavior therapy. A lot of therapists across the state who work for the mental health centers have been trained in PCIT, which is a form of behavior therapy.
Thank you, Dr. Jensen.
Dr. Jensen, you mentioned rural versus urban being a challenge. Is there any use, or is it viable for any kind of distance treatment with like telehealth or anything like that with behavior therapy?
Not currently, although one of the things we're hoping to develop in the state over the next year or so are some of those kinds of services where trained therapists might be available by conference call or by video conference. Now, when a kid is really struggling and they're really not doing well, what I have to say to parents, you know, if this were cancer, you would travel. You'd go to the university, even if it's 150, 200 miles away or wherever. And so when you've got somebody like that, then in many ways the families have to pull out the stops and say, look, I got to get my kid this kind of treatment. And the best the doc can do is really kind of encourage, admonish, those kinds of things. We are setting up a state database over the next year where you can just type in your zip code, and you type in also, this will be available throughout the state online, type in your zip code, type in the service you need, and then the program will tell you what's the closest place to get that particular service. And one of the services we will list in that will be behavior therapy. It's not there yet.
Thank you, Dr. Jensen.
So as far as just saying,
does someone else have a comment about locating behavior therapy resources, or what are the challenges in actually getting the patient in to see a behavior therapist? I mean, I heard a couple comments about payer, you know, providers only allowing certain payers, so I don't know if anyone has a solution to that necessarily, but any other barriers that point out?
So I told her I would call her, and then if we need her to come back, she can come back after that.
Okay, I think we can move on to the next slide, Kristen.
Oh, by the way, something does occur to me. There is kind of a parent training program online available through CHAD. And so, you know, it'd be a good thing for primary care docs to go to www.chadd.org, and parents can sign up for, I think there's a fee, but they can sign up, be much cheaper than, say, even paying for a therapist, sign up for kind of a parent training program that's done online.
Thank you, and I can send that information out to everyone.
Great. Thanks again, Dr. Jensen. So moving on to measure 4, and this is the percentage of patients receiving completed Vanderbilts within 30 days of medication initiation. And we see throughout the project, this has been one of the higher scoring of our measures, and we've been above goal the entire time. One of the interesting things that I've heard is, you know, hypothesize why that is the case, is it seems that parents and teachers are more apt to give follow-up on how the medication is how the medication is affecting the child rather than during the initial assessment period. So it seems like parents and teachers are more eager to tell the providers how the medication is helping than they are providing feedback during the initial diagnosis phase. I'm not sure if you all have seen that, but that's the theory that we've heard in some of our other chapter calls. And if we move on, we'll take a look at this breakdown on the practice level. And as you can see, most of the practices here are performing very well on this measure, as expected from the chapter trend line. So this is something that's been consistent across practice too, and practices have been able to get these assessments back after beginning medication. Next slide. Percentage of patients with 2 Vanderbilts within 180 days of medication initiation. So this is for patients that are moving on from the diagnosis and titration phase and into the regular follow-up. Most of the patients captured in the first couple months of this project are backdated patients, so patients that were diagnosed with ADHD before the start of the project, but then were entered into Me Health and then also entered some follow-up assessments, backdated follow-up assessments for these patients. So as we move forward, we'll be looking more at patients that were entered into Me Health since the beginning of the project, and I think at that point this data will be more reflective of the ADHD population and will be more meaningful moving forward as we'll focus on that in the second half of the project. Next slide, Kristen. And again, total symptom score, I think it was 11% for the national total symptom score reduction, 9% according to parent assessment in Arkansas, so very similar to the national average that we're seeing so far. Next slide. And this is the one that kind of stands out. This is much different than we see nationally at 20% total symptom score reduction for parents, or I'm sorry, for teachers that are returning multiple Vanderbilts for these patients. So according to the teachers, a 20% reduction is I would say that that's something positive. I think Dr. Jensen has mentioned before that he aimed for a higher reduction in total symptom score, but 20% I think is a positive sign moving forward.
Yep, I'd agree.
Excellent. And that's all I had.
Thank you so much. Oh, I'm sorry. Go ahead, Ed.
Oh, I was just going to say that's all I had. Thank you.
Okay. And does anyone have questions for Ed? Okay, great. Then we will move on to clinical questions with Dr. Jensen. Does anyone have questions for Dr. Jensen today?
Hello. I wanted to tell everybody at Learning Session 3, we're going to focus a lot on comorbidities, what you do with a kid, say, with tics or aggression or depression or anxiety or looks like bipolar, those kinds of things. So hope everyone can attend that.
Thank you. And if you think of a question later, please feel free to use the clinical listserv. It's very easy to connect with that and have various experts at your disposal to answer clinical questions for you. And I have a few LS3 pre-work instructions. I sent this out to everyone, and I will probably resend it out again, but just to remind you again to complete steps 1 through 3 before the learning session, and we'll do step 4 during the team meeting. Feel free to edit the document to include the different roles on the columns or the different tasks on the rows. And if you can please email me these worksheets with the steps 1 through 3 completed just a couple days before our learning session, that would be great. And does anyone have any questions on the LS3 pre-work? Okay, a few reminders and announcements. LS3 is coming up pretty fast, July 8th, which is a Friday at Little Rock Embassy Suites. I'll be sending out all of this information in another email in the next couple of days. Registration starts at 8 to 8:30. The session will probably end around 3:15, and lunch, snacks, free Wi-Fi will be provided. If you could please, if you haven't already, RSVP by June 30th with the names of your team members that are attending. And June data entry closes on Tuesday, July 5th. our next practice call is scheduled for Tuesday, August 16th, because we don't have a practice call in July because of LS3. And actually, we have a few minutes. Well, actually, does anyone have any questions about the announcements and reminders?
Well, I have a question. Where will LS3 be held?
It's at Little Rock Embassy Suites.
Embassy Suites, thanks.
Yes.
Oh, I see it up on the screen.
And hopefully you guys have received some emails from me about this as well. And if no one has other questions, I might go back up to the PDSAs, because I see that Dr. Schluterman and Jean are both online now, and so maybe I will just try to give them a chance, if they can hear me, to review their PDSA worksheet for this month. Dr. Schluterman or Jean or maybe Gail, are you guys on? Can you hear me okay?
Yeah, we're here.
Great.
Can you hear us?
I can hear you fine.
Good, good. Yeah, so on our measure, the 30-day follow-up appointments are the ones that we're kind of falling behind on, and a lot of it has to do, I think, in the summertime with people, you know, canceling appointments, rescheduling due to vacations and things like that. So anyway, we were trying to address getting those follow-up appointments done within that 30-day period, and so we've implemented a couple different strategies with having our nurse, when she does her 2-week phone call, reminding them, having the front desk remind them when they call a couple days before their appointments to get them in. And I think it's one thing we've learned is the parents just need constant reminder, especially over the summer, because everything is more scattered, to make sure they keep their scheduled appointments.
Definitely.
So that's good.
Well,
Do you think, so has it improved?
A little. What?
I'm sorry, say that again?
Has it improved? Tell us what's happening.
I mean, I think it's still probably too early to see much improvement because, like I said, you can call them the day before and they'll still forget to show up.
So are you keeping a tick sheet? You know, maybe the front desk or someone keeps a tick sheet so you can kind of see week to week what's happening.
Yeah, that's a good idea. One of the other things, you know, we were looking at our metrics, and one thing that we're seeing that we're not doing very well on is that 30-day getting the teacher and the parent forms in, and I think part of it is a lot of us are still doing it on paper, and those may be getting transferred over into the MeHealth. So we think that our numbers are probably actually better than what the data reflects, and so we'd like to see if Ed could send us like a list of the names of the denominators and the numerators so that we can actually go in and find out who's showing up as not meeting the metric.
That is excellent. I really think that's excellent. This is Jen Powell. We just finished the Austin learning session, and that was something that came up is that, you know, although you're wanting us to use the portal, and in particular because it's our data reporting, we are still using paper because it's the only thing that seems to be working for some of the parents and teachers. So we do need to think about how we make sure. So I love getting that report and the denominators, and then we can match it up. Ed, I think that's something we could probably do. Is that true?
That's not something I have access to, but I will ask MeHealth if they can provide that list. I don't have access to the example for parent or patient names or any other status, but we can ask MeHealth to do that, and I will do that today. I think that's a great idea. I think it is a little difficult to track down who needs what in MeHealth.
That could be part of our population approach in this next action period. So we're going to cover, you know, we're really going to move towards that. It'll be a lot of our discussion when we get together on July 8th around kind of building more of an understanding of our system and building a registry so we can track better. I think the other thing that I learned in Austin is exactly your hypothesis is that if you call them more often, they will come. And in Austin, I think that there were a lot of more focus on who is doing those constant reminders, because they agreed, they thought that did make a difference in people showing up.
Well, that is great. And does anyone have further questions for either Jen or Dr. Jensen or Ed?
This is Dr. Abraham. I'm not going to be able to attend the session next month. Is that okay, or do I have to attend, or what is?
Ed, do you want to comment on what that means from the MOC perspective, Ed? Do you want to turn it over to you?
Sure, yeah. I mean, of course, if some other members of your practice are able to attend, then you will still be able to get MOC. Is there going to be other team members?
Yes, I will be attending. Dr. Nadvi, I will be attending.
Okay, so you'll still be able to get the MOC. Is there anyone else besides Dr. Nadvi attending with the practice?
Christy.
Okay, so you'll have a couple of team members. Of course, it's the more the better.
Yeah, at least two.
It's just with summer and staff shortages, it's been hard to get everyone to be able to come.
I thought Ashley was able to come as well. Is that right?
Yeah, unfortunately, she'll be the only nurse in clinic that day, so she won't be able to leave.
Oh, okay.
Yeah.
Okay.
All right.
All right, thank you.
Yep.
Okay, well, great. If there are no further questions for anyone, thank you very much for attending the webinar, and I'll be sending out information about the upcoming LS3, and please stay tuned for the PCMH webinar.